to continue to grow. So they're typically going to be low birth weight. They can also be small for their gestational age. This is when birth weight is significantly lower than expected, given the time since conception. So even when an infant is born at, say, 40 weeks, birth weight might still be slower, and birth weight might still be low, and that's termed small for gestational age. It suggests that there's been impairment throughout prenatal development, and could be a sign of serious problems. Some of the causes of low birth weight are genetic factors, maternal illness during pregnancy, exhaustion, infection, malnutrition, drug abuse, and even multiple births. You can also see some of the different rates by country from 1998 to 2008 in this figure here. Again, this figure is in the textbook. So mothers, fathers, they're both very important in ensuring a good start to the infant's life. The father's role, they play an important role, even though it's not often emphasized to the same extent as the mother's role. Supportive fathers help mothers to stay healthy. The father can decrease or increase a mother's stress, which of course will have an effect on the fetus. Most fathers are helpful to their pregnant wives, and it's a two-way street. Pregnant mothers should support, involve, and encourage fathers as well. Birth complications, because they can have a lingering impact on later life. Mothers and fathers should help with early caregiving in the newborn if they have to stay in the hospital. And one form of care that's been developed is called kangaroo care. This is a child care technique in which the mother of a low birth weight infant holds the baby between her breasts, allows the baby to hear her mother's heartbeat and feel her body heat. And interestingly, there's been some research that has suggested that there can be a lot of beneficial effects from this kangaroo care. In particular, it may help with the bonding of the mother-child. Unfortunately, for some mothers, in fact, not a small portion, if you look at this figure here, 18 to 15%, a relatively significant portion of mothers after giving birth will experience depression. And because of when that depression occurs, it's referred to as postpartum depression. This is described as sadness and inadequacy felt by new mothers, again, in as much as 8 to 15%, in the days and weeks after giving birth. The symptoms, of course, can range from baby blues, which sounds a little bit less severe, to postpartum psychosis. Postpartum psychosis being a significant depression with symptoms of psychosis, which is defined as losing touch with reality. So oftentimes that'll involve having either hallucinations or delusions or something along those lines. Depressed mothers, they can find baby care burdensome and may think about mistreating the infant. Paternal involvement can have a beneficial effect, although some fathers become depressed themselves, which is going to have a double negative impact on the infant. The causes of postpartum depression vary, and a lot of times it's not completely understood what is responsible for it, whether it has to do with changing hormonal levels or the stresses of pregnancy or what it is. So bonding, I mentioned a minute ago. The parent-infant bond, this is a strong, loving connection that forms as parents hold, examine, and feed the newborn. Early skin-to-skin contact is not essential, which is actually an interesting finding, because in some species, particularly in sheep and in some other mammal species, this contact is essential for a parent-infant bond to occur, but that does not seem to be the case in humans. Cross-fostering in monkeys, this is when a monkey infant will be raised by a surrogate mother. When newborns are removed from their mothers, they're sometimes raised by another female or male, and research demonstrates that strong and beneficial relationships can sometimes develop, even with surrogate parents. When we talk about the influence of genetic factors, there are 4 very important conclusions that can be drawn from research. First, genes affect every aspect of human behavior. It's usually a question of the extent to which genes seem to be contributing as opposed to environment, but they are involved in just about every aspect of human behavior. Non-genetic influences begin at conception and continue lifelong, sometimes altering genetic instructions. So one of the things that makes it so difficult to understand the role of genes in behavior is that these non-genetic influences, these environmental influences, they start at conception. So the environmental influences, they don't start at birth, they start at conception. So they influence the zygote, and again, the environment can influence our genes as well. Most environmental influences on children raised in the same home are not shared, partly because parents treat each child differently. So the reason that this is important is because what this number 3 refers to here, that most environmental influences on children are not shared. The more similar an environment is for a group of individuals, the less environmental factors can explain variability in behavior. So remember, we talked about heritability before. Heritability, we said, was the proportion of variability in a behavior that can be explained by genetics. Well, let's picture an environment in which everyone gets the exact same environmental experiences. Any differences in behavior in that environment, because they all share the exact same environment, any differences in their behavior must be due to genetic differences, because again, we're holding the environment constant. And one of the assumptions in most genetic research is that when children are raised together, that they're experiencing a similar environment, and so it must be genetic differences that explain the differences between them. But what this is saying is that that's not always going to be the case, because of the fact that they're treated differently, and they do not always share similar environments. Even though they might be raised in the same home, they might be experiencing things quite differently. And number 4, children, adolescents, and adults niche pick. That is, they choose their environments that are compatible with their genetic inheritance. So, did my brother decide to go into the field of engineering because he had a genetic predisposition to do so? Well, that's, it's hard to say whether it was his genes that influenced him to do that, or whether it was part of his environment. So teratogens, I mentioned before, these are toxins that can interfere with normal development. Substances, it includes both substances and conditions that can impair prenatal development and result in birth defects or sometimes even death. Not all teratogens can be avoided. For instance, breathing in fumes. If a pregnant woman, walks by a room where there was painting going on. That's kind of the kind of thing that can be impossible to avoid in all cases. Just walking outside in New York City, you're going to be exposed to some unhealthy air at times. Structural abnormalities can sometimes be obvious at birth, but there are also behavioral teratogens which affect the child's developing brain. They can cause developmental retardation, hyperactivity, and learning disabilities. And these effects sometimes do not become evident for months or even years because it's typically, and it typically results in a change in behavior. So some of the significant factors that influence the effect that teratogens have. One is genetic vulnerability. Some zygotes carry genes that make them vulnerable. For example, certain genes increase the likelihood of cleft lip in Japanese people. As another example, some women do not metabolize folic acid well. This can result in increases in the rates of neural tube defects, one example being spina bifida. On the other hand, since folic acid has been added to many foods in the United States and Canada, the rates of neural tube defects have decreased. The timing of exposure is also a significant factor in the effect that teratogens have. We talked about the idea that there may be critical periods during development, times when, in particular for prenatal development, when a body part develops. In the first 2 months, exposure to teratogens can result in structural abnormalities. This is often it can often occur even before a woman knows she's pregnant, and this is a time when most spontaneous abortions occur. Sensitive periods, on the other hand, these are times when teratogens can interfere with recent growth. So the big distinction here is that exposure to teratogens during critical periods can sometimes prevent growth. Exposure during sensitive periods can sometimes interfere with growth after it's already started. This is a table in the textbook, once again, that shows different time points here. So you can see that the number of weeks